The Board of Sign Language Interpreters Rules Advisory Committee meetings is convening at 9:38 a.m. on October 2nd. This meeting is being held in person and through Zoom video conference and is being recorded. The recording will be posted to the internet for public viewing. I will now call roll. Darcy? Here. Natalie? She's absent today, yeah? Yeah, absent. Mel?
Here.
Lori? Lori? Caitlin? Caitlin's out. Christy?
Here.
Amber's out. Amanda?
Here.
Deanna?
Here. Pop.
Aaron?
Here.
And Maya's out today. Members, when you wish to speak, please state your first name for the record. Committee members are asked to not use the chat feature during meetings. The health licensing office asks that individuals attending through Zoom keep their phones muted and cameras off during the entire meeting or until they are given the opportunity to comment under public and party speak. Public comment is limited to matters listed on the agenda or topics relevant to the committee and statutory authority. People wishing to comment should email josh.page@oha.oregon.gov. Providing the first and last name. Everyone is asked to use appropriate language, manners, and protocols when conducting committee business. This meeting is now called to order. Okay. Hello, everyone. Nice to see you so soon. So soon since yesterday. Okay, so today on the first, let me say, good job getting through sign language interpreter and training. That was great. Good job getting through education. That was great. And so today we're going to start on the out-of-state people. It's a little bit confusing, so I'm going to try to explain it in a not confusing way. It probably won't work out, but I'm going to give it a shot. And the first thing on the agenda is we're looking at Senate Bill 950, Section 2. And Section 2 does this. So Section 2 is for people who aren't physically in Oregon, but they're providing services to people in Oregon. So like VRI would be an example of that. So in order to do that without a license, this creates the 950 created an exception. So for people who, a person who's licensed or otherwise authorized to provide sign language interpretation services in another state may provide sign language interpretation services in this state without obtaining a license from the board if the person's license or other authorization is issued by a state recognized by the board as acceptable to qualify the person to provide sign language interpretation services in this state, and if requested by the person's employer or entity for which the person contracts. The person demonstrates the license or other authorization is in good standing. So those are the two benchmarks. The board and the RAC have to decide what state-issued authorizations are acceptable. There's no, like sometimes you'll see in a statute substantially equivalent, so we know it's supposed to be similar. There's none of that here. So it's really kind of like wild horses. So what I tried to do, and I sent this to you this morning, it was going to be easier when you're on the room because I was going to just pass states out to you guys because it's confusing and each state does things very differently. And they have things that I don't even know what Q translation is. You know what I mean? So I'm not the expert in those areas. So we have to determine what state issued licenses you guys are authorizing to be on the list, which is on page 20. So that people who are not physically in Oregon can provide services to people in Oregon without a license. Is that clear? That's not. So I went through and did my best.
Sammy, can I
Yes.
interrupt you? This is Erin.
Darcy also has a question.
Yes.
When you say you're on page 20, are you on page 20 of the stuff you gave us yesterday or page 20 of the out-of-state stuff?
Oh, page 20, when I emailed you this morning, this morning, the first document, first attachment from this morning. Sorry,
Thank you.
not the 200-page one, I should have clarified that. So what I did, and Haley also helped with this, went through and kind of looked at what type of exams they took, or if there was a credentialing required, and then I added them to this list. I could be way off, I could be missing things. So there's kind of lots of options. You can say all the licenses in Alabama are fine. All the ones in Idaho are fine. I mean, like I said, there's really no limit here. You could say any license from anywhere, any state issued license. I mean, you could do that. So it's kind of up to you guys. I've given you the states I think are, equivalent. I mean, I went with equivalent because that's what my brain understands, or some similar. So that's kind of all I can say. The other thing with this is we can't ask these people for their name or information. We can never provide them with a fee or ask them for a fee. So I'm like, we're writing a rule for people we don't know who they are, but that's okay. Deanna, did you have a question first and then Mel?
I think Mel was first. This is Deanna.
Darcy's also got her hand raised. Darcy's asking, can you repeat that again? If there's a state and an interpreter in another state and they don't need to get an Oregon license, is that what I heard? If they're working in Oregon, correct?
So what Section 2 of Senate Bill 950 did is it allows a person who holds a license in another state, whatever license that is that the board deems not okay, allows that person to provide services when they're not physically in Oregon, but to people who are in Oregon. And you guys have to decide what licenses those are, what state licenses those are. So Idaho, Nebraska has a license. Alabama, Arizona. That, no, okay. Looks like Darcy has a question.
So on page 20, that list you have that you sent us this morning, I didn't have a lot of time to look it over, but so some states, whatever their rules are, I mean, to be honest with you, I mean, looking at other people, and again, I didn't have time to look at things. So that list that you put together, could we have some time to maybe discuss this in the next meeting, so we have time to look at the other states and figure out which states would apply to this, which state wouldn't, which we'd like to see, which one we wouldn't. Again, I just didn't have any time it was a lot of information. I didn't have a lot of time to look through all of it. I'd really like to look into it a little bit better to have a better idea of what we're looking for and what kind of skills or licenses would satisfy our requirements in Oregon in order to work here.
The unfortunate part is that we don't have that kind of time. I mean, we just don't have it. We couldn't start any rulemaking until after September 26th. I don't even know if I'm gonna have quorum for the 14th, 15th, and 16th. I mean, are there some off the top? I mean, I went through and these guys had at least the credential piece.
The other part is I believe there's the Oregon Health Authority medical interpreter law. Aaron helped me remember this from back in the day. We were very intentional about trying to set up a practice where in-state Oregon people on our registry were prioritized over out-of-state people providing VRI, because we didn't want a system to circumvent using VRI that, less credentials, but really it just came down to like an agency could pay those interpreters less and it wasn't providing a working and living wage for our in-state interpreters. And so when we go through this process and we look at other states, I just want to be cognizant of, we already have set up a practice or a precedent with the Oregon Health Authority to try and prioritize in-state interpreters. And when we make these decisions, I don't know if how we can keep that thread, I guess, carried over into this practice. Aaron, am I missing something?
So this is saying, so in the back of your mind, I guess you can, but unfortunately, the statutes for sign language interpreters do not in any way correlate with HCI, and we're very intentional about this particular statute. They created it special all by itself, and they wanted it for people who were doing VRI to be able to not have a license in Oregon and provide these services if they had a license somewhere else. So, I mean, the legislative history was pretty clear about that. But I mean, in the back of your mind, you can be thinking about it.
This is Deanna. First, Tammy, what was the reason you didn't pick the other states? What was the deciding factor on that? And then also, I was gonna piggyback on what Mel said, but I guess we're kind of still, I guess that's completely separate. How do we prioritize in-state interpreters over just not allowing out-of-state interpreters do that? How are we doing that? So I just really want to know what the difference was, why I know you said these had similar things, but what was the reason you didn't choose other states? Since we don't really have time to go through all of them.
I mean, if you guys want to do it on the 14th, 15th, or 16th, we can do that. Sure.
We're gonna take a moment to switch interpreters. Thank you, go ahead.
This is Amanda. I just want to go back to Deanna's question. It would help us to know how, so one of the decision factors for you in including people was that they also required credentials. Were there any other factors that you used to determine people in versus out? Because that would help us to know, like, yep, that's a pretty good baseline. We can go with that for now. And then obviously we have to review rules in 5 years. Because if you've already done the analysis and comparison, if we know what your criteria are, then we can say like, yeah, that works. Or I think there's another criteria we should look at.
I did that and I used credential exams. The thing is that everything's very different, and
Right.
so, and there's actually less states than I thought that were actually had licensing. So
Right.
Alabama was
What? And Sammy, I get, for me at least, I don't need to know state by state. I just need to know the criteria you use. So you just said credentialing and testing.
the pathways that you
Anything
have.
else?
Yeah, what's the minimum?
Okay. Thank you.
This is Dr. C. Oh, Mel, did you want to go first? No, go ahead.
So I think
No,
Aaron.
it's your-
Okay, I think someone said Aaron was next. Okay. Just, I guess maybe this is pointless, but yeah, with the Oregon Health Authority law, they included in the rules that you have to make a good faith effort to work with someone in Oregon first who's on the registry, and only if that person isn't available, then could you work with someone who wasn't on the registry. So are we saying, Sammy, that we can't do something similar where if they don't have sign language licensing in the state of Oregon, we can only work with them once we've tried to find someone who has that licensure, but they're not available, so then we can work with someone else? Are you saying that we can't add that language into the rule?
It's my understanding that no, we could not write a rule like that because this law was very intentional. It wasn't like if there's nobody else licensed in Oregon, then you can use people out of state. It was like these people out of state, if they hold a license issued by a state and the board says that state's fine, they can practice. Period. That's my understanding.
Okay, so it'd really be up to agencies and hospitals and healthcare systems, et cetera, or whoever's using the service to maybe put that in their contracts saying, we expect you to find someone in Oregon first. And if you can't find someone in Oregon, then you can get somebody else.
Erin, this is Mel. Also, we could put in our somehow like, I'm curious about saying like this law does not have higher precedence than the medical interpreter one, right? So for medical settings, the Oregon Health Authority's rule, because it's a medical setting specifically, has higher weight. If that makes sense, you know what I mean? Because one shouldn't trump the other because now they're in conflict. So now in the state of Oregon, we have two rules or two laws that are in direct conflict with each other, and that's going to be confusing.
They're not in conflict. I mean, you're required to have a license in Oregon by interpreting. You're only required to get a medical interpreter if you're taking public funds.
Right.
So this is a must. You must have a license to practice sign language in Oregon. Maybe you could put, I'm not sure how you would bridge that.
Mm-hmm.
If there's even a way, I'm not sure if there is a way. It's not my understanding that there is, since they took out Department of Education and didn't put anything else in place of that or anything in place of the medical license.
I was gonna also say, sorry, Amanda, the other piece was we could, before we look into the other states, kind of what I also got from Darcy was we can identify what are our key values or our key top credentials that we need. And then that can be applied across any state, right? Like we could say it has to have A, it has to have B, it has to have C, like these are our things. And then, you know, apply that to every state's license. That might just be easier than going through each state, but to say like it has to, you know, have an interpreter assessment. It has to have blah blah blah. It has to
I
have
mean, like reverse it.
right,
Say-
like let's say like we determine as the RAC, it has to have these elements, or these licenses have to have these key elements. Those are the key skill, the knowledge, skills, and abilities that we want to see in any license are these top whatever, and then filter the licenses through the setup filter, I guess. I don't know. The words are not here today, so.
This is Amanda. I agree with that, Mel, actually. Not like I'm surprised. I don't mean actually like I'm surprised. I didn't mean it like that. I meant it more like in a commentary of what I was about to say. Because what I was going to say is there aren't that many states that have licensure. It's not like all 50 have licensure, right? So what states are not on the list? What states didn't make the cut for you, Sammy?
Every state is on the list.
Every state that has licensure is on the list? Perfect.
Yes, that feels
Okay,
rules.
great.
No, let me get that back. Yes. Let me take that.
Okay. So this is still Amanda, because while you're looking, because on some level, I kind of feel like we're new. And as long as there's a credential, a test, and maybe one other thing, whatever we would come up with under Mel's kind of framework, maybe we start with like a license is a license. And then we see what happens from there. Like if we end up finding out like, oh, wow, that's really different than what our license is. And we maybe need to remove them from the list at some point. But right now, maybe a license is a license.
Yeah, they all made the list.
Thanks for checking that, Sammy.
This is Lori, and I would agree with that, just if for no other reason than the sake of time and us being able to actually accomplish what we're here to accomplish. My vote would be to accept other states that have licenses and hope that they've done the same due diligence that we are.
Okay. Go ahead, Darcy, Christy, Mel.
Looking at the requirements for Nebraska and what was it? I was looking at? It was Nebraska and New Mexico. And it seems that those are both really vague in terms of what their requirements are, what type of license they're providing. It's very minimal in terms of their requirements to get the license. It doesn't seem to have that full requirement for certification like we're talking about. So I would say, at least so far in my quick look, those two maybe need a further look, and maybe the rest of the list does as well, because I'm looking at those two, and I mean, I like the idea that Mel was mentioning, that we establish our minimum requirements. If we want to make sure, like, say they have a 3.5 for the EIPA, for example, then we can say like, okay, then we can use their interpreters because that minimum requirement is met for those licenses. Or they have the NIC as a requirement for their license, or RID certification of some sort for their license. So those two criteria can be ones that we establish and say, if that license requires it, then we know that they're gonna work for our community. I'm wondering if that's a better way to look at the list. Or say like they have medical and legal licenses or certifications there, and so those are good minimums to establish as licenses from other states that will permit to work in Oregon versus just saying any license is good enough, just because specifically Nebraska and New Mexico, their requirements are not clear enough for me to feel comfortable with them.
They are pretty clear, I think.
Say more, Sammy.
Applicant for an interpreter or
I guess, yeah, what criteria we're using when you look through and added these all to your list?
each pathway. Under generalist, exam, credential, experience and exam. So they're required to be awarded a certificate from the RID or hold a level, well, I think that's 4 or higher of the IPC awarded by the NAD, or hold a valid level 4 or higher in the interpreting or transliterating the Mid-American Quality Assurance Screening Test awarded by Nebraska Commission for the Deaf, or hold a state certificate or license that is substantially equivalent to one of the following. So that's to get a license in Nebraska. Look at that next.
This is Christy. I was just going to say I agree with the previous discussion around accepting based on credentialing and licensing. I also think, you know, we're in a place of trying to get as many interpreters as possible, so I don't want us to narrow it too much Yet I also recognize that we want qualified interpreters.
And New Mexico is very specific as well, more specific than the other one. The interpreters are going to switch. Okay. So do you want to, how do you want to move forward?
This is Mel. While I understand the intent behind this piece of the Senate Bill 950, I also have concern about funding going to other states. The offsetting of the HLO fees. So, you know, to run our program, it does depend on others, you know, our out-of-state people to pay licensure in Oregon. And there's nothing to now stop Oregon interpreters going out of state to get licensed in another state. Not that we would ever do that, but I mean, it creates a way for that to happen. I guess there's nothing we can do about that though.
This is Lori, and just as a reminder, this is for people who are out of state who are interpreting from out of state. So
Yes.
this is not people in Oregon who can go to Idaho, get licensure, come back to Oregon, and then expect to interpret.
Okay, thank you for that.
It's kind of like what you guys wanted, under, when we worked on, never mind, that's not true. Never mind.
This is Amanda. Just for a short bit, as we've been talking about, like the criteria we would set, we've been talking about exams and credentials. Is there anything else we would put in that filter? Because if it's exam and credentials, then Sammy did that. Right? So is there other criteria that we would add to that list that's in our licensing? The only other kind of complication, I think, is the levels that we have, right? We have provisional, we have generalist, we have supervisory. Other states have other levels that may or may not correlate, right? But I mean, if I think about ours, it's language proficiency, credential, and then credential at a specific level. So maybe kind of like Darcy was saying before, of like what our cut score would be of, only states that allow a 3.5 or higher, or whatever, if they're using EIPA as a credential kind of idea. I'm just curious, is there other criteria we would use? Because otherwise, I think that work has been done, if I'm understanding correctly.
Most states don't have like that work experience pathway like you guys do, because you renew. Most of them require the higher credentials or exam. Both.
This is Deanna. Can I go ahead?
Yeah.
Okay, great. This is Deanna. My question is, because we don't want to reinvent the wheel, right? I mean, I think you've chosen some states you really took some time to look into what they were requiring. Could we just take like 10 or 15 minutes and just go through those states and take a look at some of them? Is that something that we can do? Because why reinvent the wheel if there's have some good requirements. I know I'm looking at one of them right now. I don't remember which one I clicked on, Idaho. And like one of their things is you can never have been convicted or found guilty or received a withheld judgment or suspended sentence in this state or any other state for any crime. I mean, I'm not saying that we want to hire felons or anything. I'm just saying, I mean, contract felons. I'm just saying, can we just take 10, 15 minutes and just look through them and see if there's something that we can utilize?
Yeah. Aaron and then Mel. Aaron.
Thank you. This is Erin. I just want to make sure that I agree with the exam and the credential as the baseline. I just want to make sure that's not limiting any deaf interpreters in other states by creating those expectations, right? Like deaf interpreters can access those two things just as easily as hearing folks. And if that's the case, then that's great. And that's it. That's all I have to say.
Erin, this is Mel. I want to clarify your statement. Are you asking if in those states deaf interpreters have access to their license as well?
Yeah, would deaf interpreters in other states be able to meet those minimum standards that we're asking for to get the licensure in their states? Like if we're basing it on exams and credentials.
I'm not sure what we can do, like put that in, like say, never mind. Sorry.
This is Mel. I think that would take looking at each state's license to see if it even addresses deaf interpreters. And it might be that we have the best license for out-of-state interpreters to get, potentially. We might have created a pathway that's more accessible. I'm curious about that. Thank you for thinking about that. I was just thinking to the piece about from yesterday's conversation. If we have VRI and we have interpreters in training on VRI, then first of all, like people from out of state couldn't be supervisors, right? Because they don't hold our generalist and they don't hold our supervisory license.
Yeah, if they don't hold them, then no.
Right. So just making sure that that would be made clear. So I'm thinking about it, if I'm in a classroom and I get a sub through an agency and it's a remote class and I have an intern placed in that class, that intern no longer can be in that class if I don't have verification that the sub interpreter holds the Oregon generalist or supervisory license.
So let's circle back. So are we okay with putting all of the lists that I have here, the Alabama, Arizona, you guys okay with all those? Do you want to go ahead and add them? Do you want to wait and move it to a meeting on the 14th, 15th, or 16th? How would you like to proceed?
Darcy's your hand up. I was actually wondering if, Mel, would you mind saying, you were saying if there was a replacement where both hearing interpreters or team interpreting remotely, the second one being, from Oregon and one holding a supervisory license, that would or would not transfer for the intern to be able to join as like a party of three. Actually, could you ask Darcy? Thank you. So the first interpreter is an Oregonian and has a supervisory license. The second interpreter maybe is an Oregon interpreter, but they're sick, and then an intern. So if the second one was replaced because they're sick, right, and they didn't have an Oregon license, but the first one is this with the supervisor is sort of taking responsibility for the interaction or something like that. It would have to have very clear, specific language around that. Or if the person who was sick was actually the supervisor and is responsible for the intern. Could the first, interpreter take that responsibility? So that's just something that I'm thinking about if someone was willing to take the responsibility for the intern who has the appropriate licensure. I guess that's something to think about as we're going through the steps of this process.
Yeah, this is Sammy. So I think that's addressed under supervision of the SLI and training person, and then the supervision of the provisional. It says, here's the duties that you have to do, here's what you're responsible for. So that's covered under those duties.
Yeah, this is Mel. My understanding is, and I'm probably wrong, it's if the supervisor is the one who calls out sick, right? Because I could have a provisional, I could have a supervisor and a provisional and in training, all in a class. And the provisional is not the one providing support.
Right.
But then also, to sign off as somebody's supervisor, say I did find another interpreter from, the out of state or even in state. They have to be assigned supervisor for my interpreter in training or my provisional. So I'd have to, there's just we're getting in the weeds, but that becomes complicated.
Well, I think
Because I find last minute subs 30 minutes before a class starts.
if you want to put rules in that say you can use a sub 30 minutes as long as they hold a license, you could do that. If you want to go that far, or if you're a supervisor and you're supervising this provisional license holder and you are sick, that's not gonna work out because you don't have a supervisor for it. So I'm not sure if are we trying to just make sure the provisional can work? Because in that case, you gotta just find somebody else who has a generalist or provisional and add them to their list. And then nothing needs to change, it just remains the same. It's supervisor on their list of supervisors. I think that's what I'm hearing.
It will just mean more work for the coordinators.
This is Amanda. So I get that this is an impact of this particular part of the law and the rules that we're going to make. I think this is actually, though, and I just kind of want to ask because Natalie is not here, so I'm going to ask the other hospital folks who are here. I think the primary reason that this came about was because they were concerned about providing emergency services in the hospital and having to use a VRI service that was out of state and not having somebody who was licensed in the state, but also needing to be able to provide emergency services. So I'm not saying this doesn't apply to what you all are talking about, but I think the primary reason for this exception, I know it's not an actual exception, sorry, I'm using that word incorrectly, but the reason for this piece being added in was for hospital VRI stuff. Not that it would only apply to them, but so I just kind of want to, just since Natalie's not here, I want to advocate on her behalf. And if any of the other hospital folks want to chime in on that, because that was a high concern for her.
I'm a hospital folk. This is Erin. And yeah, I mean, that you're right. We just need to make sure that we can still work with video interpreter services until an in-person can get there. And our expectation is that that sign language interpreter is going to be qualified to do that. And that can look lots of different ways. I think I'm not still understanding if it requires licensure even in other states.
Yes.
You know what I mean? What if they are in a state that's not on our list, but they are still qualified by their vendor? Does that mean we absolutely can't work with them? Which means, are we going to have less access the sign language interpreters, because that is a concern of mine. Like, I don't want poor quality. We need to have good quality conversation here, but maybe that person is qualified but doesn't meet the letter of our law. So that's where I'm a little bit worried.
And this is Amanda. Oh, sorry, Sammy. I just saw your hand. Sorry, go ahead.
So unfortunately, the way they wrote it is they gotta have a license in another state. I mean, there is another spot, under section 7 that allows somebody to physically come to Oregon and work temporarily for, let's say, 90 days, 30 days. And they can hold different types of credentials. But in this case, for this specific provision, is you have to hold a license from another state. These are some of the downsides of putting some specificity in the statutes.
And this is Amanda. However, this is better than what it was, because the list of people you could use on VRI before, or actually currently until this rule comes into effect, was literally Oregon licensed people. So now at least we have licensed people from any state. So yes, it's still limiting of qualified people, but it expands it to licensed people in other states, which feels like progress from where we were. And maybe we need to go a step further in the next iteration of the law.
We're gonna take a moment to switch interpreters.
So to circle back on
Sandy. What's the musical chairs? Go ahead.
So this is Sammy. Are we good with the A through N of states on the list? Have 3 yeses, 4. Aaron has a question. Go ahead, Aaron.
This is Erin. I guess I'm thinking about what you said earlier, Mel, that so as a healthcare, so which law trumps the other? That's what I guess I don't understand, and maybe I need to just take that offline. But as a hospital system, we have to make a good faith effort to work with someone on the registry. But I guess the sign language license law trumps that. So it sounds like there is a potential that if we can't find someone who meets our laws, like our video vendor won't actually provide us interpreters that aren't licensed, which means we may have less access. I guess we'll just have to see what happens. I don't really understand how this affects. I need to talk to our vendors to see, does that mean we're going to have less access to people because they work with interpreters who are in states that don't fit within this criteria? Does that make sense? I think I'm having a hard time explaining myself, but I'm just thinking out loud that there actually may be an impact, which case that would be really bad. So I just need to do more. I need to do more research. But in terms of the list that's there, I'm fine with that list. I'm just worried about those exceptions.
Erin, this is Tina. If you have vendors that are out of state that aren't licensed, don't have licensure in those states, they can always get licensed in Oregon and still be on the list.
That's true, and that takes time, and emergencies happen constantly. So I do hear what you're saying, though.
There is an exception for emergencies.
There is?
Absolutely. Yeah, if there's an emergency situation. Hold on, let me get it.
What section is that? I thought I read something in there, but I wasn't sure. Sorry, I don't mean to derail this.
It's on page.
Oh, here it is, section 7.
Section 7.
Thank you. Okay, thank you.
This is Darcy. I have a question. Suppose general hospital settings, you've got different
Clinics.
hospitals, different interpreting agencies, BRI, specifically, who is working for these agencies? AMC, Linguava, Lingo. There's lots of different agencies that hospitals and clinics contract with for medical interpreting. So of those, are all of them, you know, very specific, or do you have different people that are kind of in that same pool, all working for different agencies? How are we getting that clarification of who those people are, who those contractors are contracting with, what licenses do they have, from which states do they have their license? Who's sort of monitoring those contracts? Are the interpreting agencies themselves doing that monitoring, self-monitoring? Is that?
How do we make sure they're compliant?
How to make sure they're compliant? Can any interpreter just contract with them and work regardless of whether or not they have licensing or credentials? Do they have to be specific medical? How are they working within their own states to get their medical credentials? There's lots of different variations of a lot of these things. So I'm just wondering, like, ERI and hospitals, I mean, I prefer they don't do that. Obviously, preferring in person is better. But sometimes you have to do that before somebody shows up in person. So, I mean, there's lots of different variations depending on the sites. So, I don't know, just kind of an interesting thought when I sort of just kind of rumbling around in the back of my mind. So, what are anybody else's thoughts on that?
Yeah, Darcy, this is Erin. So working in a hospital, at least at our hospital, we contract with vendors who their expectation is to follow the law and to provide us people that are on the Oregon Health Authority registry. And now, of course, the sign language interpreter law. So we write that into the contract, but it's also law. So they still have to do it, right? But we, at least at my facility, and I know that at like others like Salem, like where Natalie works, we do compliance checks. So we'll ask them to prove that their people are following the law. So they actually have to give us the materials that show that they are following the law, you know, like their certificates and things like that. And so, yeah, it's up to the healthcare systems and it's also up to the agencies.
This is Mel, if you want to get really nerdy and techie. When I ran a call center, each interpreter had a profile in the computer system. And I can imagine that VRI hospitals have the same type of profile, and it checks all states to see if that interpreter has a license for which state. And then when a call comes in, it routes that call to the available interpreters that meet that specific state's requirements. It's all back end within the profile set up for the interpreters, and they match it and then route the calls that way, would be my thought process on that.
Okay. So, you guys want to walk through the fiscal impact of this? I got what you said, Erin, about, they might meet the credential, have an RID or, be a CDR or whatever, but not have a state license. So they wouldn't actually be able to work under this exception. So I got that in here. In the fiscal impact. I guess the Department of Wars. So who's this going to affect? Would this affect state agencies? Like, are there main agencies that use VRI, or people who are out, not in still hospitals?
This is Amanda. Do colleges and universities count as state agencies? Because Mel has just told us that she uses VRI. So that would be a state agency if it, I mean, community colleges maybe not, but like universities use VRI, so that would be that. I'm sure VR, vocational rehab uses VRI, I'm sure. DHS probably uses VRI. I mean, any of the state agencies that have deaf consumers, I can imagine use VRI even if it's just as a backup. School districts, I think, use VRI from time to time, whether that's all the time or as a sub or, you know, those kinds of things. So I think all of those.
Yeah, I can use all that. It's somewhere in the fiscal. It's kind of, it ends up being kind of a big pile.
This is
Of course.
Darcy. This is Darcy. Maybe this isn't a fixed fiscal impact, but it does affect deaf people and deaf clients. When there's, you know, a weak signal and VRI is glitchy, you get interpreters from different states who, different accents. They're not familiar with the different signs, of Oregon. Like Pacific Northwest signs. There's lots of regional signs that come up that, are kind of throw glitches and things, right? And so a lot of the acronyms people don't know, when you're on VRI. And so the deaf people, maybe don't fingerspell very clearly. So I don't know, or fingerspelling of the regional names. So I don't know that, a lot of deaf people aren't super satisfied with VRI. Especially in doctor's offices and clinics, especially when you have technical problems, it'll go down for 10 or 15 minutes. And then a new interpreter will show up and then you gotta struggle with the technology and now you're trying to. You can't really have those in-depth conversations with your provider in those situations when you've got technical issues coming up. So those things do impact the situation. And those things, we try to avoid using VRI too much because of those limitations.
Got it. Thank you, Darcy.
This is Deanna. So we utilize VRI. We try, of course, we always try to, when our clients request an ASL or a deaf interpreter, we always try to put someone on site, which is better always. But when there's a need for VRI, we try to use our pool of interpreters. And then, well, we have a couple of places that are very rural, and they have an emergency need, and we've supplied them with tablets, and they utilize tablets. And though that's from a third party contractor, and so sometimes, and you're right, it's not ideal, it's not what we would prefer, but there's that need, and I think we have to make sure that we keep that in place for the emergency need. It's not always perfect, again.
Thank you. That's helpful.
This is Amanda. I feel like we're mostly talking about like the negatives, which I suppose is maybe what impact is, but there's also a positive side to allowing this, is kind of what Erin was mentioning of like there's actually availability for people to get services. There's availability. There's also some people who prefer to have an external interpreter who has no awareness of their community at all in some of their medical or educational or any of those kinds of things, right? So I know I assume impact is about negative impact, but there's also a positive impact that can come from VRI being available and expanding who is able to provide those services in the state of Oregon.
Why did you say people sometimes don't want an interpreter that they know? What did you said?
Because they don't want people in their business.
Thank you.
Yep.
Thank you. I'll figure out a way to say that nicely. No, and it is about negative and positive.
You could, this is Erin, you could say, you know, confidentiality or privacy concerns.
That's good.
And this is Darcy. Especially like counseling sessions. Most common in counseling sessions where you're meeting with a counselor Here in Oregon, what we have a couple, two, maybe three signing counselors. And so that can always be a little awkward when you put an interpreter in that situation from the community. So sometimes it's nice to have an out-of-state or person from out of the area, just for confidentiality and privacy purposes, because the community is small, especially the deaf community, it's even smaller. So medical privacy, you don't want everybody knowing your medical stuff, especially when you show up to a doctor's appointment and you see an interpreter that you are familiar with. Yeah, some of those things can be kind of awkward.
Good point. I wouldn't have thought of that. Okay, and then I don't know if there's any kind of racial equity impact.
This is Amanda. I think, oh, sorry.
Musical chairs.
This is Darcy. In terms of the impact there, I was thinking about, this small number of BIPOC interpreters that we have here in Oregon who are also deaf and maybe prefer to have another BIPOC person in the room with them. So possibly by having access to out-of-state interpreters, we can have a preference met there with those VRI interpreters. So that could be a benefit, is having those out-of-state entities give us more opportunities to work with the folks. And that could be great because it might be, say, someone who speaks other languages as well. They might be a trilingual interpreter. That could be really beneficial. So being able to go directly to that person who has those other skills could maybe better support our community here beyond just ASL English, but there might be other, experts. There might be CDIs or even hearing interpreters that have other expertise outside of the state of Oregon.
That's great. Thank you. I think that answers all. No, so I think that's all the questions I have. That's all really good information. Thank you. You guys want to go to the next one? I think it'll be pretty easy, hopefully. I see that. Okay, we're going to page 25. So this is the exception. So this is like, somebody's gonna come in and work temporarily for 3 months, 3 to 30 days. What you guys get to decide what the number is to recommend a number to, the board. In my research, it's between 30 and 90 seems to be the common thing among the states. There are a couple outliers, or they have a temporary thing, but it's not, they don't use it in the same way. Because this is a little bit different. This is actually an exception that you can work in Oregon physically for X number of days if you have a credential or a license or something from another jurisdiction. The laundry list in here is much longer. And this, I probably should have started with this one because this lays out the pathways much nicer. Because then you can be more specific. So if you start on page 28 of the rule, this is what I use. What's the criteria I use for the other one? Same thing. I don't know why I'm holding it like you guys can see it.
This is Amanda. One of the questions I had, Sammy, was if this is an exception to needing a license for whatever, all the things that you said we have to decide, what does the paperwork look like on your side? They fill out a request for an exception? No, wait, they fill out a request for an exception?
No.
What do they do?
Good question. If they meet something specific, let's say they have RID, specialist certificate performing arts, nothing. Right. The thing where it gets tricky and still kind of a work in progress is I did a catch-all rule, which was my first pass. It's on page 31, number 4. And I don't know what that person's gonna look like. But it's basically if they're coming from, let's say Spain has licensing and they're not on the list. So they could come to the board specifically and say, board, Spain, da, 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 da. I don't know exactly how that's gonna work, but something like I put in here, they'd have to request it within 60 days, complete a form, provide us some information. So this is still a work in progress. This is kind of a catch-all. I'll probably, so it's to try to hopefully catch people that we miss.
Okay. And now that you said Spain, this is Amanda, now that you said Spain, it makes me think, right. So number 4 would be for like international, like we have, I don't know what the letters mean. Mel will have to help me with Mayusa, but like when they would come and if interpreters were provided with those international people who came to the state for a visit or something like that, they would have to say something as to why they're here and get an exception in some way. Is that what you're kind of saying?
Yeah, and the other thing is,
okay,
how do you write? I mean, we're never gonna know any of this ever unless files a complaint.
Yeah.
And when they leave, I don't know what happened. Like, I'm not sure how that works. If they're in an exception and there's a complaint, so there's some murkiness that I've never dealt with in licensing. So some things I just don't know. And we just have to kind of see how it plays out. But basically, I just took everything that was in the generalist and put it in here. So that if you hold these credentials, you're in. And if you're from any of those same states, you're in. And in Canada, because they were pretty robust licensing. And then a process to request from the board that they want you to look at something else, another jurisdiction or another state, whatever credential that I don't have on here. I don't know who was first, Lori, then Aaron.
I'm a little concerned about it having to be the board's decision. Is that in statute or is that just in the draft that you created?
No, it's in statute.
Oh, it is. Okay. Well, then I guess my concerns don't matter. That is all.
I mean, what you can do is you can put the criteria that you want the board to utilize when they're deciding. That helps.
Yeah, I just, given that the board may or may not be meeting on a regular basis.
They have to be quarterly.
Oh, they do? Okay. Okay. Well, then, okay. That makes me a little more comfortable.
We have other programs like cosmetology. If somebody fails more than 10 times, we do have situations where we'll call an emergency meeting to get somebody to retake a test or something. So those kinds of things do happen. And we'll schedule extra meetings for that. Erin?
This is Erin. So that might have answered my question. I'm just thinking, are there circumstances in which someone needs to come quickly here from somewhere else and they don't have the luxury of 60 or 90 days to get permission to temporarily provide services? And with that case, what do we do? I guess they're going to call an emergency board meeting.
I don't know. I'd have to look into that.
This is Amanda. I had a similar concern as Erin, but I think that's only for number 4, correct? If you have one of the other pathways, I'm credentialed or I'm, whatever, I'm just assumed, yep, you can have an exception for X number of days, right?
Yeah.
It's only if I don't fall into one of those categories that I need the 30 or 60 days or whatever it was, right?
Correct.
Sammy? Okay.
So this is Erin again. So that might have a potential impact on folks from other countries, which may be a racial equity impact, to be honest, depending on where they're coming from. So that's just something to keep in mind.
Do you know other countries that maybe have a licensing?
Is there international, some association that might know?
This is Darcy. I was thinking as I was looking over this list that it seems like it's all focused on English to ASL interpreting and maybe could include trilingual. So typically it's Spanish is what we see most often. But what about other languages, Norwegian Sign Language, Russian Sign Language? Here in Oregon and in Washington, we have huge communities of deaf folks from Ukraine and Russia, especially those two areas, like particularly, and also Bhutan. And there are some sign language interpreters that perhaps we would need who know those languages. There's a fourth one that I can't think of. But there's many folks who are refugees from those countries, and they've come here and live here, mostly Vancouver, Portland area, I would say. Maybe some also in the Southern Oregon area, but in the Pacific Northwest. So, and who knows, there might be more communities later that we see more of this with. There are a few DIs who have expertise in these languages. Sometimes we do have to use out-of-state folks and have them come in to the state to provide interpreting so that we can have access for these individuals every once in a while. So I'm wondering if we're calling folks from out of state, then with all these different requirements, you know, many of those folks do not fall under these states with licensure or anything like that. So I don't know if there's a way to do some sort of exemption to licensure when it comes to there being other sign languages of lesser contact. So other languages that we might need, I don't know the wording for it exactly in English, but when we have that need and there are specific individuals who can provide it that aren't on these lists. And then is signing Darcy, I think. We have
We think
I
of
think
that
we
language.
did that.
the emergency section of it,
Or something.
something like that.
So
Talking
something
about
that
how to
explains-
Few meetings
describe
ago.
people who have language. Sorry, Amanda, you're just on my screen.
if you don't have this rule in your packet because we did it already, but you actually made an exception for this, which I'll just read it out loud. A person is not required to hold a SLI license under this statute if extenuating circumstances exist. And an SLI determines use of the unlicensed SLI is necessary to provide services to ensure cultural or linguistic competency while sign language interpretation services is being provided.
This is Mel too. I was gonna add in that segment that I was reading, it said something like if the interpreter falls under the jurisdiction of something else. And the situation that I would see this also coming into is with the Oregon Judicial Department finding interpreters, and they do not have to follow this. So that would be the one that I would see also commonly used is finding interpreters from other countries. But that takes care of that one, and they can fall under that jurisdiction. And some countries do have training and stuff like that from other countries, and it could qualify as well.
Oregon should definitely develop some sort of list or registry of that sort, because we do have great folks who provide those language services here in Washington. So we should have something where we're keeping track of those folks out of state and have that at the ready.
Thank you, Darcy. That triggered my memory about what I wanted to say too. Some of the biggest comments I hear is about interpreters in Vancouver or Washington not wanting to pay for our license to come into Oregon to work. And we have a lot of specialty interpreters in Vancouver and Seattle area that do travel down here. But Washington does not have licensing at this time. They do qualify for our credential, like our license. Many of those interpreters do. So when I think about this specific piece, it's like, so, okay, Washington, awesome, great, unique interpreters that we need. How many times can you come into Oregon to work before we say, come on, buddy, you are profiting in this state, you need to get a license, right? Like what's that magic number? And I kind of think just throwing it out, there's 30 days. It doesn't have to be successful days, but 30 days in a calendar year or something like that.
Perfect.
This is Amanda. Counter. I think there maybe should be something about consecutive days, because I was thinking of this rule having to be more about like when there are national conferences and we fly interpreters in, or there's a special need, OJD is exempt, or there's a special need, like this is the rare exception. But if we say 30 days, that means I could not consecutively. That means I could come down from Washington twice a month, 3 times a month for a whole year, and fine, no license required, as opposed to like 30 days being 4 one-week conferences that you come out of state. So you've come into the state 4 times to provide specialty services, as opposed to just like your regular gig twice a month. Do you know what I mean? So like at what point do we have that conversation about what you just said of like, come on, you're making money off of Oregon, why would you not pay into the licensing system? Yeah, so that's interesting, because I was envisioning this purely as the conferencey people. I wasn't thinking of our Washington friends, or maybe even our California friends, or our Idaho friends, or right, like I wasn't thinking about those. I was thinking about conferences, as opposed to regularly working in, right?
I'll just counter.
Interpreters are gonna take a second to switch.
I'll just counter real quickly your counter, Amanda. And I'll use your own stuff is like because we're trying to keep interpreters here, right? We don't want to diminish our pool of interpreters. And I think it is so hard to fill jobs now for the medical appointments and all of that in Portland, that if we put this in place, it's gonna impact our the services in this area. Yeah.
Can I counter real quick, Erin and Lauren?
Wait, Mel, can you repeat that, Mel?
I'm just saying, like, right now it's hard to fill jobs as it is with Vancouver interpreters to get them to go across the bridge. It's just a bridge, but you would think it's something huger than that, but they're not going to do it. And so if we put in more barriers for them to come across to fill jobs for us, I think it's going to impact us, and we're going to not have that pool. We're going to lose that pool of really qualified interpreters. And we've said from the beginning, we don't want to push people out. We want to keep as many people in as we can. And we could change this number later, like slowly get people used to it, kind of do that tiered approach over time. But I think currently 30 unconsecutive days shows them we acknowledge this is going to be hard, and we want to be in a relationship with you, and we need you. But
so my counter is that I don't know the data on this. Like, I don't know how many people we're talking about, right? But the more people we say don't have to pay into licensure, the higher the rates are for the people who do pay into licensure, because the cost to have licensure is the cost to have licensure, and it's divided by however many people buy the license. So if there are less people buying the license, we pay more. So if they are people who are earning in Oregon and not paying for the licensure system, then we just acknowledge we want you so badly, we're willing to pay your licensure fee.
I mean, that's outside of our control. At this level.
Darcy has her hand up.
Do you mind if I go? This is Erin. I just am wondering who's going to keep track of all this? Like who's keeping track of the 30 consecutive days or the not 30 consecutive days and then following up with them to say, hey, you've done 30 consecutive days. You need to like meet these other requirements. Like who's keeping track of all this? That's what I want to know.
Nobody. Aaron, nobody is. This is an exception. If somebody files a complaint, we would investigate it. I don't know what that would look like, to be honest with you. Show us records. Do they have records? They're not required to keep records. But how are we gonna require them to give us records if they're not required to keep them? Because they're not licensed in Oregon.
So this is Erin again. This will be complaint generated, it sounds like.
And even if, yeah, that's the only thing I can see. And even in that case, I don't know how you would hold anybody accountable to it unless it's clear that they're working 6 months, you know, in that sense. Lori and then Amanda. And then Darcy.
My idea will be a very unpopular one, particularly with the people who are in Vancouver. My idea is that number 30 is really high to me, and I think as the exception, this number should be something like 10, because if people are coming in here on a regular basis, and in here I say that like it's ours, but you know what I mean. If they're coming to Oregon on a regular enough basis to need 30 days worth of work, they should have an Oregon license, particularly if there is no such license in the state of Washington. They're not having to doubly pay. That may not be the case in California and other states, I get that, but my vote would be to have this truly be an exception. It needs to be a small number.
Works for me. Lori, I had the same thought about so if a person, you know, if they're given an opportunity to come here and they pay for the licensure fee, right, for 30 days or whatever is set, 10 days, whatever, and they do pay for that, right? Is that what you're saying? Or there would be none. Okay, so then how are we going to prevent, for example, Vancouver area people or anyone from Washington State who's just across the river and they're continually coming into Oregon? You know, could they come the next 30 days or 30 days after that? Is it gonna be how many days in a year, or how are we going to monitor that to prevent people from taking advantage of this loophole, essentially, compared to the people who are working here consistently or paying for a licensure? So who is going to be looking out for that and monitoring that? I think it really does need to be clearly set up from the beginning. There is a limit of, for example, 1 month in a year, the end. And if you want to work more days here, you have to buy the license. So that would be an idea to prevent people from abusing the system and abusing this exception for the people who are living close to us.
So if you look on page 28, number 1, that's up to 30 calendar days.
Page 28?
Yeah, 30 calendar days in a calendar year. The only question was the consecutive. And then on page 31, number 5, once you've done the 30 days, then you have to get a license under A through D.
So I'm looking, you said 28, and what was the other page number you said?
28 and 31. And 28 sets up the calendar days and a calendar year.
Okay,
And
that's good.
we do need to know how many hours in a day. So is 1 hour considered a day? And 8 hours considered a day? I don't know.
Yeah.
So this is Amanda. What I think I'm hearing is that this is largely a symbolic rule to say, don't be afraid to come to Oregon and work for any bit of time. We're not that strict with our licensure that you can't come interpret for a conference or come interpret for a medical appointment. No one's going to monitor. No one's going to enforce. We can't even really punish you if there is a problem. But we just don't want you to be scared to come here. if that's the rule and we have no teeth, then I think 30 days is fine. Consecutive, not consecutive. Nobody cares. Nobody's monitoring. I don't think we need to be clear. I think we just need to use it for marketing purposes to say, no, 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 our licensure has an exception. You can come interpret that conference. You can come interpret this medical appointment. You can come across the bridge even, because it's okay. You can have an exception, right? But I think it just like it's largely for show is what it sounds like to me. Yeah. Because there's nothing you can do about it.
This is Mel. This is kind of where I was gonna go. Yes. Yes, Amanda. You've seen through the smoke and mirrors, okay? You got it.
Legislature, darn them.
And maybe those Washington interpreters did do the Oregon Health Authorities training and Oregon did get some of their money or something, like, right? So there's something, because they're using it to come in person. Yeah, so there is some relationship. I agree. I
No,
think
I mean, I think it's a good
the-
marketing tool. I think it's a good marketing tool.
I am just scared that we would lose some really, really skilled interpreters in Vancouver and vice versa. And it's just not, I'm willing to let this one go. Yeah.
Also, this is Darcy. From another perspective, you know, maybe we could lose interpreters who are skilled deafblind interpreters, and there are several of them in the Vancouver area. So we are risking that impact to our deafblind community here in this area as well. And that is going to happen, frankly. So, yeah.
Darcy, can you clarify that?
There are interpreters who work with deafblind folks, some deaf interpreters, some hearing interpreters, and they have specific skill set. And it's not just the Portland ProTactile, it's called ProTactile. And people who are in Vancouver often go up to Seattle. There's a very large deafblind community up in Seattle. People are very qualified working with this community, and we often say, hey, come on down and work with our people. And here, if we set this up, it's going to be a huge barrier for them. And I think our deafblind community here will be suffering from that cut, because to take a deafblind training and to work with, like I said, both deaf interpreters and hearing interpreters, with all the federal budget cuts that are happening from Western, from WU, I think it's from other sign language interpreters internationally, and also the deafblind interpreting community. I think we really do need to consider the impacts of this big time.
So, Darcy, are you saying that they don't meet any of the qualifications on the list, these people? So they couldn't work for X number of days in Oregon? Is that what you're saying? Or am I confused? What am I missing?
No, what I mean is that many deafblind interpreters who are very, very qualified, and they are working with our deafblind community. Often they are coming over here, like for example, at Chestnut Lane, which is a deaf senior citizen living center here. You know, there's 15 to 18 clients there who live there, and there are many interpreters who come over on a regular basis to interpret for these Oregonians, deafblind Oregonians. And so it's going to impact these individuals.
From Washington. We don't want to disrupt.
I guess
Because they'll have to get an Oregon license to come and work in Oregon State.
so they would be working more than, like, say, the 30 days. Like maybe they're working 6 months. Is that what you mean? I'm trying to make sure I'm gonna get it right when I write it. Because this is saying you can come in for X number of days as long as you're meet a qualification on the list. But it sounds like maybe one of the two things, those people don't meet a qualification, so they don't qualify, or they do meet the qualification and they want to work longer. Is that right?
Okay, yes, yes, the second thing you said.
Erin and Lori?
Thank you for that additional insight, Darcy. It makes me wonder if we could write in an exception that says if you are a deaf-blind interpreter or do pro-tactile or tactile interpretation, there's no limit on the number of days that you can provide interpreter services. Would that help fix the problem?
You do have an exception for the tactile and pro-tactile. You wrote that about 5 meetings ago, but not for the deaf interpreter, deaf one. No exception for that. This one.
This is Amanda. Aaron, I don't know if you were on the board yet, but we determined that this law does not apply to tactile interpreting, which is what pro-tactile is. It only applies to visual interpreting. So deafblind interpreters are already exempt. Not exempt, they don't, it doesn't apply to them. They don't have to follow this law.
Lori?
This is Lori, and as perhaps the holdout jerk on this topic, I will concur with the rest of the group, provided that the interpreters coming in from out of state are held to document the days that they have been here in the event that that information might be needed at some point, or some checks and balances are required. Because I don't like the idea, even if we have no teeth, I don't like the idea of limiting to 30 days and then having somebody come in here and working 180 days without being called on that, even as a potential.
And this is Mel. I would just also share, Lori, I believe a lot of agency owners and vendors and employers are going to want people to have the license to be in compliance, right? So there are layers of incentive, I would say, to make sure people get, pushed to get that license. And we have the complaint process. Like, again, this is going to be an unpoliced practice, as Amanda liked to point out, but so if there is a complaint, then it is when we would have to get that higher level of scrutiny. And then we don't want that interpreter here anyways, so.
Right, but we have CODIS Plus in Vancouver, and lots of people in Oregon use them. So you're right. I would hope that agencies like that would require licensure or even pay for it themselves for their interpreters.
We're gonna take a moment to switch interpreters.
Sammy, can we put that in the rules? This is Amanda. Can we
Darcy,
say you have to document it?
I can put it in and see if it works. I mean, I can try.
Again, I'll just be that one turdy holdout too, Lori. For me, when I work in the courts anyways, I have to get a letter that says I've worked over 40 hours, I think, or 100 hours. I don't remember a minute, like in a year, 5 years. And I go to the agency and say, I need you to run the data to tell me how many times you sent me across the river. Like it would be CODIS Plus. That would be the one. And that would only happen if I needed it. I think thinking that the interpreters are going to keep a log. They don't even keep a mileage log, although they say they do. But you know what I mean? Like there's ways to get that information, even if it's just tax records or whatever. But that would, again, be if there's a complaint.
Don't be telling all our secrets, Mel.
Sorry.
Were you guys good with the 30 calendar days? Okay. And is there, like, if they come down and they only work for an hour, does that count as a day? Yes. And we agreed on consecutive? Not consecutive, I'm sorry.
Oh, no, this is Darcy. I thought it was 30 days consecutive.
No.
Did I misunderstand?
I mean, it can be.
I just said.
I don't think I would recommend that.
This is Mel. I think we talked about not consecutive days because people, Amanda was thinking conference people, and I was bringing in like, well, maybe it's a medical appointment or a visit to Chestnut Lane or intermittent appointments. And so having it broken up seemed like a more fair solution. But also if we're only counting 1 hour as a day, that also has an impact.
And then for the list is the same states that were in the other rule. And then this is all of the qualifications to get your generalist license. So I just copy and pasted it in because you already decided that that's good. So, and then I'm still gonna be working on 4 and how that is gonna shake out. I'm exactly sure. I gotta work with Tina on that. And then the fiscal impact on that. Thinking would probably be similar. One. Yeah, I think it's the same agencies, I mean, it's kind of across the board, where it's a deaf consumer, then it's relevant. Same with being in medical hospitals. Lori?
This is Lori. I'm wondering, Sammy, about on page 28, all the list of criteria for folks to be able to come into Oregon to interpret without a license.
On page what?
28. I'm just wondering if we have, well, my initial thought was, why wouldn't we just duplicate and say if you have a license from another state, but that won't work for the state of Washington where they don't have licensures. So
Right, and
maybe
it's actually,
maybe having something like this is important.
yeah, because the majority of states don't have licenses.
It just gets so nitpicky to me for something that's not even going to be monitored. You know what I mean? Like, you have to hold these criteria, but actually you can come in no matter who you are and go ahead and interpret pretty much for as long as you want. And unless somebody complains, you're fine. Well, 30 days theoretically, right? But
This is Erin. I'll just say that I think it's helpful for those of us who have contracts with various companies, because this to us is our guideline. So we'll look to the law and say, hey, are your people following this law? So it gives us guidance as to what we can expect from the people that we work with.
yeah, for the people who are legally compliant, this will be helpful. For the other people, it's not going to matter anyway, I guess.
Most of your licensees are from out of state currently. Hopefully that will change as we go through. Okay. Anything differ in the fiscal impact, like what racial equity, or it's?
This is Amanda. I think it's the same, and particularly what Darcy was mentioning about in the last one about just the variety of interpreters available to come from out of state for this limited period of time allows us to be more I don't know the word, the English word, more matching to clientele, more apt interpreters for them. English is hard, sorry.
So it's a good thing?
Yes.
Okay. Okay, we have 15 minutes. You guys think you can do provisional? 15 minutes? I have
This is
faith.
Amanda. This is Amanda. Don't we have to figure out what we're doing 14, 15, 16? If we are meeting or not meeting? If we have quorum or don't have quorum?
True, that's a good point. We can do that.
Says Aaron, don't we have to leave room for public comment?
Yeah, is there anybody on?
The same person that was yesterday that didn't have a comment.
Okay, so I'll go ahead and read public comment now, and then we'll talk about 14, 15, 16. Okay. At this time, the Board of Sign Language Interpreters Rules Advisory Committee will hear public and interested parties' feedback. Public comment is limited to matters listed on the meeting agenda or topics relevant to what this committee has statutory authority to regulate. Each of the staff will request public member to unmute themselves. The chairperson HLO reserves the right to end a person's comment early, and I make sure the staff mute the public member if the comment does not pertain to matters listed on the agenda or topics relevant to what this committee has statutory authority to regulate. Are there any members of the public who wish to comment? If so, please raise your hand using the Zoom feature and wait to be acknowledged. Anybody? Melody? Okay. Nobody has any comments? Okay, so for the 14th, I don't even have a quorum. I only have a quorum for the 16th. So I don't know if everybody is like, sure. We need to meet. Still have to look at fees. I mean, you don't have to relook at provisional if you guys are fine with the board deciding what the EIPA score transition would be. I mean, they're gonna decide at the end anyway, but.
Says Aaron, how many are you short on the 14th?
On the 14th, all 6 show we need 1 more.
So I can do the morning, but I could do it remotely, but I can't do after 12.
Actually, only 5 on the 14th. I'm not sure if you have noticed.
Oh, I might not have an updated thing, sorry, we did update yet since yesterday?
I think Maya might have updated her.
Okay.
Okay, never mind.
Aaron, you could go till 12.
On the 14th, yeah, I could do till 12.
Could Darcy or Amber, could you guys go till 12, either of you?
Yeah, this is Darcy, yes. Yeah, I'm available on the 14th, yes.
The 14th, this is Amber. The 14th, I am completely booked. I won't be able to attend at all. But the 15th, I have on my calendar, and on the 16th, it will be a late arrival.
Okay, if you guys can come till noon, we can do the 14th, and maybe we start the meeting at 9. So we get 3 hours, 9 to noon. Does that work? Okay. The 15th.
This says Aaron, I will be late because I have a meeting that ends at 9:15. So, but I can join right after.
Darcy's switching on the 14th so she can attend, right? I'm updating the.
Yes, she can attend until noon.
Yes, yeah. I am available all day on the 14th, whatever you need.
And then Aaron was the other one that was switching.
Aaron's is good till
Till
noon on the
noon,
14th.
correct.
9 to noon, Aaron, you can do on the 14th?
A 9:15.
Or 9:15, okay.
9:15, okay. 9:15.
This is Amanda. Does that put us just at quorum?
Yeah.
Dang it. Okay.
Yeah.
This is Deanna. I could also be there until noon virtually if you need to meet the quorum.
You're already on here.
Yeah, we already have.
You're already attending. What about,
Yes, I'm sorry, I was looking at another date. Yes, you're right.
Did you do the 15th? I think the 15th we're gonna not. Mel, you're out for the 15th, right? And no Maya for sure. Christy, you're no, right?
I'm gonna know both 15th and 16th.
So it looks like, I mean, we'd have to have a miracle to have the 15th work, but we do have the 16th covered. Thank
For
you.
half the,
We're gonna change it very quickly.
But there's a couple things. Everything is ready. Hold on, just. Everything is ready for you guys to review, so you guys can come. Everything prepared. I'll resend everything again with all the most updated stuff. So you have, all next week to look it over, be prepared so we can hit the ground running. So maybe we only have to do one day.
Can you summarize what we have? We have half a day on the 14th currently, quorum.
Correct.
That's it?
and we have the 16th.
And the 16th would be,
And just to clarify, 14th is 9:15 to noon, is that right? We have on the calendar?
and the 16th, 9:30 to 2:30.
Is it 9:15 to 2:30?
The normal 9.
9:30.
And how many people are we short for the 15th?
We only have 5, right?
We have 5 confirmed. Is assuming everybody's,
We have 5 confirmed, so we need 2 more people for the 15th. We'll send this back out again.
I think I put myself down for the 15th, yes?
Yeah.
I can never remember which days I'm like, yes, for this one or that one. Yep.
Deanna, can you do the 15th? Very asked for that.
This is Christy. Do we want to look at additional dates or not?
That's up to you guys. Let me see.
How about some
It's-
Friday? Would Friday be possible? The 17th, Friday the 17th?
Oh.
Does that mean the 15th is completely out?
I mean, it's possible 2 more people can jump in, but at this point, I would say probably not. Probably out.
Okay, thanks, because I want to be able to open my schedule up if possible.
I don't think we got confirmation from Deanna whether she could attend on the 15th or not.
Can you attend the 15th, Deanna?
Yeah, I can do the 15th.
Oh, you can. Okay.
It looks like on the chart that I'm looking at that Caitlin has a 0 for the 15th. What does that mean?
Maybe.
Yeah, that's maybe.
So she's
Maybe.
a possibility.
Yeah. We have something in our, we have something going on the 17th. It's really kind of the only days. Monday we have something.
this week or this month back.
What's our end date of when we need to be done with all of this? Like, we can't look in November, we can't look in, like, what, remind me the statutory
For
timelines
950, I have to present all this forward on the 22nd.
on the 22nd. Okay.
At least the pieces for the 950.
Is there anything we can do email, or does it always have to be in a convened space?
Convened space.
This is Amber speaking. When you say the 22nd of what month?
Okay.
October. Okay.
This is Amanda again. So the prioritized remaining items are fees.
Fees, that's the one thing you have to get done.
Fees.
still.
Okay.
Yep.
And that's a fee structure essentially, right?
It's, I think we're gonna present I don't know, numbers
Okay.
to you next meeting. And I'm not exactly sure how it's doing, but yes.
This is Lori. You also mentioned the EIPA.
Oh, so let me just run through. So the pieces of 950 that you guys have to get done, you did the training license, check. We still need to look at their supervision requirements. I think they're gonna be very similar to provisional, but I just wanna have you keep track on them. You did both of the exceptions today, and then the fees. So on the other stuff, yes, so under provisional, there is the EIPA score transition, which you guys have that now. You can look at it in your own, private conclusions, and then bring it at the meeting. And then the other one is allowing that license to become dormant, because it only has the 2 renewals. So if, as long as you request, there'll be a form, that you go dormant, and you'll be able, as long as you request before you become inactive, then you can become dormant. And then once you want to get out of dormant, you pick back up, you pay some dormant fee, and then move along. But the kicker is that you're gonna finish. So if you ended on the first 12 months of your first license, then you're gonna finish out that last 2 years when you go to get it renewed. It's gonna be a little complicated on our end, but you guys should be fine. But it does still give them the option to put that in a reserve so they aren't wasting their 6 years. Yeah. That's the dormant. Generalist, that there's the APA score, you're gonna change provisional. I think you guys said you want to change generalist, so I'm looking at that structure. And then the recommendation letters, there were, you guys wanted agency, an SLI agency, and how that's gonna look. So there's that piece, so those 2 things are highlighted. The big yellow letters. And then the last one for supervisory is just verifying that I got that continuing education where the 60 hours, the 20 hours of supervisory can be part of the 60 hours in the credential that you have. So just making sure that that's not an additional 20 hours. No? Okay. You're scared is she getting it? Okay, then renewal. No? No, that's it. Because I put renewal with everything. So if we just stick with those things, I know we get it done in 1 day. Oh, no, wait, we do have to go back and revisit in training with the direct supervision. So only 2 days.
So this is Lori. So we've got half a day on the 14th, a full day on the 16th. Those of us who've committed on the 15th should keep that in case we can get Caitlin to join the party on the 15th, question mark?
I would, yeah.
Okay. I'll put the pressure on her through Facebook.
And if you guys want, I can send a summary of what I just said, so you guys kind of have a good idea of what exactly we're gonna be looking at. Okay, I'll do that. Okay,
I
great.
wouldn't mind and emailing it earlier if possible, so that we have enough time to actually like look through it and do our own research if we could.
Everything that you have now is exactly what you're gonna have then. But I will resend
Great.
it
Awesome, thank you.
today. Yeah, good job. We got a lot accomplished today.